Our next guest says that 70% of women aren't getting the right type of health care. Many of us have a symptom or two. We go see a doctor, prescribe some medicine without looking at the root cause. With us this morning is Dr. Dina Pavilonis to tell us more about her new book titled No More Band-Aids. Good morning, doctor.
Good morning. Thank you so much for having me.
Thanks for being with us. 70% of women not getting the right kind of health care. What does that mean?
Well, the problem is there are numerous studies on gender bias and inequality in healthcare. For example, in my book, I mentioned a study done in 2008 in emergency medicine that when women went to emergency room with a severe stomach pain, they waited 33% longer than men with the same complaint. Also, the most research and diagnosis and treatment historically mostly conducted on men, leading to limited understanding of women's unique health needs. And unfortunately, some doctors are quick to stereotype women as hypochondriacs or relate their ailments to anxiety, depression, or hormonal changes. And because the average primary care doctor has only 15 minutes to spare for a visit, it's much easier just to focus on symptoms and addressing the symptoms, as I said, putting Band-Aids on them.
So is that part of why it's just kind of popular to not find the underlying issue? They just don't have time?
Yes, that's definitely a part of that. But another big part is that, as I said, that historically, most of the research on diagnosis and treatment is unfortunately done mostly on men. But things are definitely changing over time.
What advice do you have for people that are struggling with certain symptoms or struggling with the care from their doctor?
I encourage my patients to not focus on treatment of symptoms, but getting to the root cause. And it has to make sense. For example, if you have any issues with, eczema or chronic fatigue and things like that, don't get and treat yourself with just symptomatic relief like Tylenol for headaches or steroid cream for eczema and things like that. But in my book, I outlined step-by-step instructions how to get rid of how to get to the root cause of most chronic conditions. And there are many ways of addressing those things holistically when you understand the root cause.
Do you hope that patients read your book, or do you hope that doctors read your book?
I'm really hoping for both.
Anyone, right? Everyone. When you tell patients that you want to look for underlying factors, is there any resistance? Do people, because, we don't have a lot of time either. So we go to the doctor, we hope for that prescription maybe, and we say, I don't have time to go do blood work and go get labs and stuff. Is there a pill that I can take?
Yeah, and the symptomatic treatment works only temporarily. And unfortunately, it's a quick fix, yes, but it's not going to get you to the long-term good results. And that's why I always start the visits with spending at least an hour getting to the root cause of, when did the symptoms start, the lifestyle, the stress levels, how people, do they consume sufficient nutrients? Do they sleep enough? And those are very important factors to consider when you're looking for long-term solution for most of the health ailments.
All right, your book is called No More Band-Aids. Where can we get it?
It's on Amazon. You can find it by looking for No More Band-Aids by Dr. Dina Pavilonis, MD.
Perfect. All right, well, thanks for your time this morning. Really good advice. We appreciate it.